GOP leaders in the Senate, Paula, have delayed a vote on health care reform until later next month at the earliest. That means there will be more time to debate over what's really wrong with the current bill and how to fix it, as well as what's wrong with current law. WBZ political analyst Jon Keller joins us now with some of the key points on this.
Yeah, well, Liam, we hear a lot of rhetoric about how out of touch Washington politicians in the bubble or the swamp down there can be. We've heard it all during the campaign. Well, today, Republican Governor Jon Kasich of Ohio was making that case. He's an opponent of his party's reform plans on health care, and he aired out some interesting concerns about the GOP proposals. Here's one of them.
Fortunately, we've been able to. The amount of funding that they're putting into Medicaid, just Medicaid as a whole, is even less than what the House had. And what the House had was really not adequate. On the exchange side, one thing that has been kind of shocking to me is there's not enough funding over there as well.
Well, that's been a major complaint of everyone from insurers to consumers. Several studies claim the feds grossly underestimated, when Obamacare started, how much it would cost to stabilize the insurance industry and keep coverage affordable during the difficult adjustment to the new Obamacare realities.
And both the House and Senate plans would actually reduce that funding. Who's to blame for that?
Well, look, as President Trump has pointed out, if you want to go back to the beginning of this problem, health care is very complicated. And the bottom line is everybody relied on the good judgment and bipartisan diligence of Washington to work things out. That was a mistake. Kasich made some other interesting points also that haven't been heard over all the partisan posturing. I'll be exploring some of those tomorrow on WBZ This Morning.
Bipartisan diligence. We haven't seen a whole lot of that recently.
It's almost like an oxymoron.
Jon Keller, we'll keep an eye on it. Thank you very much, Paul.